Hi guys, welcome back to the channel. If you're new here, my name is Nosa. I'm a medical doctor in the UK and I make videos on medicine and lifestyle. I recently started a PLAB series. If you haven't watched how to prepare for PLAB 1 and you haven't passed PLAB 1 yet, I'll leave a link up here, also in the description box down below, so you can go and watch how to prepare for PLAB 1 because you need to pass PLAB 1 before you pass PLAB 2. Anyway, this video is about how to prepare and study for PLAB 2. PLAB 2 is a bit more complex than PLAB 1. It is not a written exam like PLAB 1. It is actually an OSCE exam, and it is testing more of your communication skills, your history taking skills, your practical skills, as opposed to your clinical knowledge, although that is also required. But the assumption is you've got that because you prepared for PLAB 1, which is why I advise that you should not leave a long time gap between taking PLAB 1 and PLAB 2. I took PLAB 1 in November 2017 and I took PLAB 2 in early March 2018, and I kind of had a break in between. So it's very important that you don't take too long between both exams, so you can still have that fresh clinical knowledge from PLAB 1 to help you in PLAB 2, and you can spend most of your time in PLAB 2 focusing on getting those extra points for interpersonal / communication skills, history taking, practical skills, and so on. I'm going to divide this video into different sections. The timestamps would be in the description box down below, so you can just jump to whichever part you feel is relevant to you. I'm going to start with a quick overview of what the PLAB 2 exam is about. I'm going to go on to how to prepare and whether you should attend one of these courses or not. PLAB 2 is a 3 hours, 10 minutes OSCE exam that has 18 clinical stations and 2 rest stations. So those 2 rest stations, you're basically resting. You're not going to be doing anything and you can use that time to think, but you have 18 situations where an examiner will be present, a patient, which is an actor, will be present, and yourself. Each clinical station, so each one of those 18 clinical stations lasts 8 minutes in total. You have 1.5 minutes outside the door before starting the station to read the scenario and decide on what you want to do. Which brings me on to my next point. Majority of people that have failed PLAB 2 have failed based on communication skills and also not understanding the scenario outside the door. You need to understand what's being asked of you. If they ask you to do something specific, so go and communicate with an angry relative, and then you go there and start trying to take a history, you haven't understood the question and they're not going to give you any point for that. So make sure you're understanding the question and you're acting on the question. In total, there's 12 points in each clinical station. Each station's 12 points is divided into 3 sections. 4 points for interpersonal skills and communication skills. The other 4 points will be for data gathering, technical and assessment skills. This is basically your history and physical examination. So as you can see, you have the same points for communication skills as you do for history taking and examination, which just lets you know the importance of communication skills here. I'm just really emphasizing that to you guys so you don't waste your time focusing solely on history and examination like a lot of people do in their medical school OSCEs. The last 4 points out of 12 in each of the clinical stations comes from clinical management skills. So this is basically coming up with a solid plan for your patient. Now let's quickly talk about the breakdown of each stations, what majority of them cover. So like I said before, there are 18 clinical stations. I would say about half of this, so about 8 to 9 of these stations are based on communication skills / interpersonal skills. 3 out of the 18 clinical stations are on physical examination. So you could be asked to examine a real knee on a person, a breast examination, but that tends to be on mannequin. So those would roughly be about 3 out of the 18. Another 3 out of those 18 clinical scenarios will be based on your history take. Those are pretty straightforward because a lot of people have done that in medical school, and those of you working are doing that on a regular basis at work as well. And then generally there's usually 1 station for peds, 1 station for obs and gynae, 1 station for psych, 1 station for surgery. Bear in mind that these numbers tend to vary, you know, per group. So some people will have a bit more communication skills, some people will have a bit more physical examination. It really depends. There's no set number of things, but this is the general framework that PLAB 2 tends to go by. So let's just quickly talk about passing PLAB 2. There's 2 criteria you need to meet for passing PLAB 2. Number 1 is to pass a minimum of 11 out of 18 stations usually. Bearing in mind that this number can vary. Sometimes they say you can pass 10 out of 18 depending on how everyone else has done. Second criteria is that you have to get a minimum number out of 216, which is basically those 12 points per each station multiplied by 18. Again, this number varies, but in general, the number in the past couple of years has been a minimum of 125 out of 216. PLAB 2 cost £875 as of 2020, so you really need to make sure you pass the first time because that can get expensive real quick. Finally, let's talk about how to prepare for PLAB 2. I think you need about 4 to 8 weeks to prepare for this exam, depending on your individual circumstances. 4 weeks if you can dedicate a lot of time, about 10 hours a day, to this exam. A bit more if you've got commitments like children, school, all of that. You decide. But I spent 5 weeks preparing for this exam and I felt like it was more than enough. To pass PLAB 2, you need a study partner. There's no way around it. PLAB 1 is a maybe, you could benefit from one. PLAB 2, in my opinion, is a must. You need to practice your communication skills. You don't have to have someone in person. You can have Skype, join a Facebook group on PLAB, get someone you can be practicing skills with. This is just so necessary because you can learn something, but unless you actually practice it, you don't actually get to feel and learn properly for an exam that is based on your clinical skills and interpersonal skills. In terms of where the possible scenarios for the PLAB 2 exam comes from, it's listed on the JMC website, and I'll have a link in the description box down below of all the possible scenarios you can get and the exact page you need to go to see what possible scenarios you can get. But I'll list some of the common ones I know of on this page as well. So the first domain that is covered by this exam is the practical skills, and it's usually done on the mannequin. So for example, you might be asked to insert a catheter on a mannequin. You might also be asked to check blood pressure on a real person. You might be asked to show your venipuncture skills, do some CPR, read an ECG. It just really depends. I must say though, I've never heard of anyone getting 10 scenarios and practical skills. It's usually 1 or 2. So don't spend all your time focusing on these, but you need to obviously practice this. So the thing with practical skills is that it's actually hard to practice practical skills if you haven't got access to a mannequin. And you can't get access to these mannequins unless you're right in medical school right now, which of course makes you lucky and you can continue to practice while you're there on mannequins if you get the chance to, or you're attending a course. Those courses as well usually have mannequins for you to practice on. But if you're not able to attend one of these courses and you're working as a doctor at the moment, then take the opportunity to practice your practical skills. Look at the list of scenarios which I'm going to leave on this side again that you can get, and try and practice those skills on real patients, and hopefully for the real exam you should be fine in this section. The top website I recommend highly for practical skills and seeing the standard expected of you in the UK for practical skills is geekymedics.com. They've also got a YouTube page, but I watched so many of these videos on my iPad while preparing for the PLAB 2 exam. Watching them over and over again, it kind of makes things stick if you're practicing them as well. The next domain covered by this exam is your interpersonal skills. So the examiner will be seeing what your communication skills are like with patients. So in this case, so you might be asked to communicate with relatives, you might be asked to break bad news, you might be asked to explain a new diagnosis to a patient. So for example, you might be asked to explain a diagnosis of diabetes to a patient in layman terms, so you should avoid medical jargon. If you use medical jargon, you lose points. And also you might be asked to explain an investigation. So a common one I heard of was endoscopy. Explain to a patient what an endoscopy entails, again in layman terms. When it comes to explaining like investigations, diagnosis to patients, the patient NHS info website is very, very useful because it's designed for patients. So you can see how the NHS kind of explains new diagnoses to patients like diabetes, rheumatoid arthritis, all of that. And it's helpful to see how things are explained without the use of medical jargon. I also recommend this other website called oskistop.com. It is very, very useful for communication skills like breaking bad news. For example, if you have to break bad news about cancer to a patient, there's this general format some of you might have heard of called spikes. Basically, the Oskistop website has a lot of scenarios that can help you with that, and those scenarios you see are commonly tested in the PLAB 2 exam. So the last domain is clinical examination. You can be asked to perform a clinical examination, that is a physical examination on any body system, cardiovascular, respiratory, all of that. One common one that people tend to forget is also you need to know how to examine the prostate. You can get like a mannequin that you know, you insert a looped finger. You need to explain all of that to the patient while you're doing it. It's important that you treat the mannequins like you treat a patient. They want to see your communication skills as well during those stations. Don't forget that. So don't just go in, stick your hand in someone's bum and not say anything. You need to treat it like a real examination. I'm about to insert my glove finger into your back passage. It might feel a bit cold, but it shouldn't be painful. If it gets uncomfortable, please let me know and I'll stop. But anyway, the clinical examination skills, I recommend again geekymedics.com. You can learn how to do physical examinations at the standard expected in the UK. Can I just recommend one document every PLAB 2 examinee should read? It is the common errors to avoid for PLAB 2 exam, written by a PLAB 2 instructor. It is on the GMC website and I'll have a link in the description box down below. You need to read it, but it's also basically telling people what they should not be doing in this exam to prevent them failing. On whether I think you should attend a PLAB 2 course, yes, I don't think there's any reason why anyone should not be attending a PLAB 2 course if they can. Emphasis on if they can. Most people attend a course these days, and I think it's just hard to prepare for this exam as well if you don't attend a course, because a lot of these courses, for example, have mannequins. You can't get access to mannequins if you're at home, and you're likely to get a mannequin in your exam. Also, you get to meet other people taking the exam the same time as you. That way you can form a good study group. You guys have the same goal, same end date for the exam, and you guys are at the same pace most times. So that is another reason why I recommend attending a course. Lastly, you get to do mock exams, but you don't necessarily need to attend a course to attend the mock exams. You can actually just pay for mock exams on their own, depending on which course you attend. I personally attended the Samson course. I recommend it for the exam. PLAB 2, you guys can definitely ace it, and just make sure you give yourself enough time and you're practicing. That's what this exam is about.